Thank you, Madam Chairman. Fellow Toastmasters and most welcome guest, Brian. An easier way to doing implants. When I was a pharmacist at Georgetown Hospital some 20 years ago, I can remember we had an 18-wheeler, brought in a medical grade CT scan. It was so expensive they couldn't afford it. It was over $1 million. And as time has progressed, the costs have come down and it's easier and more productive to purchase these machines. There's a big sale going on with these and they're really sweeping the market. What if you knew that there was a way to look inside your head and plan things before someone ever touched you? And what we can do today is this. We can actually take an image of the skull and create a three-dimensional model. And in that three-dimensional model, what we do is we select the size of the implant, the diameter of the implant, and the projection of the implant. And once you've done that, it gets even easier. We send this information off to our company. It's either in the United States or Switzerland. They create what's called a surgical guide. So the surgical guide is placed in the patient's mouth and attached, fixated, and then we simply drill the holes for those implants. We don't make any cuts. We place them in there. In a case that probably took about 4 hours, you can probably do in 30 minutes. So one thing I'm proposing to you is if someone can do that, take a difficult case and create that outcome, what are the benefits to the consumer? Well, there's less trauma to the individual. Perhaps you can do that and create a benefit in terms of cost to the individual. If you can only reserve 30 minutes of your operational time, can you benefit someone by a quick hour? What about morbidity? They would have less trauma because you didn't go in there and waste time cutting in different directions. And most importantly of all, you avoid important vascular spaces and nerve spaces. One thing that's really tricky, and you don't always realize that, in the bottom of this lower image, there's an artery. It's called the facial artery that runs in here. And if you ever cut that, you better get them to the emergency room. So those are things that you can plan ahead of time, do all the work on the model, show that to the patient, and you can imagine, can you build confidence with someone before you go in there and start cutting holes in their heads before you do the surgery? Well, I believe you can. So, do you have that model at this point we're passing through there? Okay. What you see there is a model where usually we do those in freehand, and it takes about 6 to 8 months to finish that. You place the implant, you let the side heal. There's one company that's checking in 6 weeks to see if those are then ready to be fixated. But the difficulty is the bone has to grab hold of the implant so that it's stable. You place a little fixture called an implant abutment, which is the part that sticks up like the tooth, and then you send the case off to the lab for another 10 weeks and you're done. Why would you even want to do an implant or implant bridge? Because this is it. When you have a crown on a tooth, in about 10 to 12 years that crown is going to break down, and this is why I always replace bridges, is because they get decay around the bridge. You know, in the past, if you lost a tooth, we'd say, well, gee, you can put a bridge on either side. But the problem is you have to cut down sometimes perfectly natural teeth. You put the implant on there, you traumatize the tooth, now you've got to do an implant, and then when you get decay on that bridge, you got to replace the bridge and do it over again. And you know, why do you want to keep doing that? So at that point you've created self-expenditures, whether if you've just done one of these, the cost is just, you know, about 20% more, and you're done. You're not going to get decay around these. If you can do reasonable home care, it's a wonderful opportunity. So there's becoming a paradigm shift in how we place implants in terms of being more efficient, simpler, less trauma to the patient, and who wouldn't like to have everything planned out so you can show you what you're going to do, so you get it done, and get out. Madam Chairman.